Chairman of the Republican National Committee, Michael Steele. He joins us live from the Republican National Committee studios in Washington, D.C. Mr. Chairman, it's great to see you. Thanks for coming.
Hey, Chef. Good to be with you, man.
Your thoughts on the bill that was passed by the Senate Finance Committee today?
Well, I'm disappointed that they still refuse to go to where the American people want them to go, and that's
to a public option.
No public. I mean,
actually, the polls show that the American people want a public option.
No public. I mean,
actually, the polls show that the American people want a public option.
Yeah, okay. Yeah, okay. I'll buy. I got a bridge to sell you as well. But the reality of it is, look, the Democrats have an agenda, and their agenda is
Republicans
to do
don't?
national. Look, the Democrats have an agenda, and their agenda is
Republicans
to do
don't?
national. To do a health care system. Republicans have argued from day one. And are we really going to have to cut Medicaid or Medicare, for example?
Why are Republicans against a public option?
Because it's government-run health care. It's government control.
It's not government control, Mr. Chairman, with great respect. It's not government control at all. As it has been laid out, it would be a government-run...
Really? And you believe this, Shep, you believe this, with all respect, you believe this.
I can tell you that what the Democrats... What the Democrats proposed, with great respect, what the Democrats proposed... It's a satellite delay. It sounds like we're being mean to each other, and
we're not.
We're good friends, and we wouldn't do that.
Go ahead.
But the truth is that the government-run or public option would be an effort to keep the costs down by allowing those who wanted to come to the government option and a not-for-profit option in an effort to keep the costs down and offer an alternative. But Republicans are against that, and I'm curious why. Because the Democrats say it's because you're in the pockets of the insurance companies, and that in fact even Olympia Snow's greatest contributor is the insurance industry.
Well, you know, you did a great rendition of the Democrat talking point.
I'm telling you what they say. I'm going to do the same thing with Bill Nelson in a minute. I'd just like to know your thought.
No, I know, and I'm going to give you straight up. I think everything you just said is absolutely accurate, and I think the fact is that once the government gets his fingers in this particular pie, it is going to grab for more of it, and the individual will lose those options to grab for more of it. Employers, who's going to, you're going to take that cost and keep it? You're going to take that cost and keep it? No, you're going to tell your employees, guess what? This idea that you somehow are going to have a choice in the matter is not the case. Employees, employers, 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 it gets back to the core point that insurance costs money people don't have.
Right now what we have is a private health care system, and it's been working, depending on your experience, well or not so well over a period of years. But one of the things about privately run anything is when it's privately run, you go in, you pay for it, you get the benefits, and if you don't pay, you don't get the benefits. But this is America. So it's sort of a flawed system to begin with, isn't it?
Well,
because even if you don't have insurance, God knows we're not going to let poor people who don't have anything die on the emergency room table. And if you don't have insurance, God knows we're not going to let poor people who don't have anything die on the emergency room table, and this just isn't working.
Well, Shep, I agree with you, and you're absolutely right. It is a flawed system to the extent that it has a human element that it recognizes is very important. A human element that it recognizes is very important. A human element. It is a flawed system to the extent that it has a human element that it recognizes is very important. That, to your point, we don't want anyone to be left on the streets on the side of the road, to die from
but that private system can't work that way, can it?
But the reality of it is we don't want anyone to be left on the streets on the side of the road. But the reality of it is to deal with those people who have fallen below even the safety net, to deal with those people, for example, for the very poor, to make sure that they have access to that system. We don't believe this is the kind of health care reform that's going to be in the best interest of the best interest of the best interest of the country. So work with us to help us get the Democrats on the right page here. And we're hoping that as we go forward, we're trying to remake it and rebrand it and redo it, grow the influence inside of the size of the federal government. More and more people will see that this broad-based government grab of health care is not the way to do it. A slow, steady, bottom-up,
doctor-patient. Now, those are the talking points, but that's not really true.
That's not really true.
No.
Come on, Chairman.
No. Hey, Shep, you know me. I'm not a talking point guy.
Talking point guy.
That's honestly how I feel. Honestly how I feel about it, because I see the effects of it, and I know ultimately what it means for my mother.
Two quick things before we go. For one, have you spoken?
I said when I ran for chairman that I wanted to take this party to the streets. I want to put it out there in the neighborhoods, go play with, have some fun with it. Come on and get engaged with the GOP. We don't believe.
Chairman Steele, thanks. The Democratic side next.
You got it, buddy.